Good afternoon, everyone. Welcome you all for another wonderful session today. And this is our first session. Hope we can wait for 1 or 2 minutes, and maybe we can start by 1:33 like this. Okay. On behalf of all of you, I welcome Ms. Sophie to present today, and also as I mentioned earlier, right? So this topic will help you in your day-to-day life, and it will help you to understand the importance of the work like as a coder. And regarding the members, I would like to say that no need to give your member IDs or anything in the chat. We will be providing you a form at the end of this session. You can just scan and fill your member details so that we can post CEOs for all of you. Okay. Also, beginning of this year, we have changes in our offices. So if you log into our AIPC local chapter in the AIPC account, you can find our new offices. Okay, so whoever is there, there is one change here this year in the education officer. So you can check the new officer there, and you can feel connected with us. And also, starting this year, we are planning for at least 4 sessions in a row it will be more continuously. We will be having those sessions. Inshallah, we are planning for that. So our next session, we already registered for Feb 7th. Okay, so you would have received your emails. So don't get confused that seeing two emails back to back, right? So after this, the another session will be very close. That will be on Feb first week. Also, we would like to share the update that we are collaborating with almost more than 5 or 6 chapters in our nearby area, like Dubai and Chennai. Okay, also Hyderabad, and Kerala. Okay, all these presidents, we are collaborating with each other, and we are finding time that best suit our members, so that there will not be any overlapping, and our members can attend almost all the sessions, so that it will help them to get CUs. So instead of overlapping with the session, so there will be always a choice of selection always. So whether I need to attend this or that, and because obviously you will be getting only one CUs at the end actually, right? So instead of that, we are planning and arranging our sessions so that almost all our members can get benefited and with their CUs as well. Okay, so that's the collaboration we are working currently. Hopefully, this will benefit all our members in the upcoming days. Okay, and Sophie, I think the stage is yours. It's time to start. Please go ahead.
I'm audible, right?
Yes, Sophie, you are audible. Please go ahead. Thanks.
So, hello everyone. My name is Sofie Anna Thomas. First of all, as this is our first session in the year 2026, I wish you all a happy new year. I'll introduce myself a bit shorter way. I began my education in Nasik, Maharashtra, completing my 10th and 12th grade there. And then I moved on to the CBSE board for my 11th and 12th grades in Kerala. I pursued my undergraduate degree in perfusion technology from NGM Institute of Health Sciences, Navi Mumbai, Maharashtra, which was a 4-year program. After graduation, I worked as a trainee perfusion technology for 6 months in Bejewadia Pediatric Hospital, Navi Mumbai, and then completed my internship there. However, during the COVID-19 pandemic, our whole department was redirected towards the COVID care. And because of this, it limited my exposure towards the perfusion technology. During that time, I discovered medical coding and then I got certified in it. My career journey then took me to Nasik, where I worked in WMS Global Services, and then eventually I moved to Abu Dhabi. I have been working in a hospital in Abu Dhabi for 4 years, gaining valuable experiences. I am thrilled today to bring this blend of skills and experience to APC Local Chapter Abu Dhabi and look forward to collaborate with you all. So, once again, good afternoon, everyone. Hope you all had your lunch. And thank you so much for joining at the APC Abu Dhabi local chapter today. I'm truly excited to here to discuss on a topic that is not just important but essential to our healthcare success. That is the crucial role of medical coders in strengthening the revenue cycle management or the RCM. So let's start by reflecting on the significant on what you do every day. Every day, as medical coders, you perform work that is often invisible to most people. Yet, without your accuracy or your consistency and attention to the detail, the entire healthcare system would struggle to function and efficiently. Every code you assign and every claim you validate ensures that the healthcare providers are reimbursed correctly and compliantly. This supports not only the financial health of the healthcare, but also their ability to continue deliver the quality of the patient care. And I want you to remember this. Even if patients may never meet you, or your work directly doesn't touch their lives, but it does happen. Because when hospitals are financially stable, patients receive better services, better technology, and better care. And I want to ask you something. How many times have you wondered if your work truly makes a difference? And the truth is, it absolutely does. You are in many ways the guardians of the revenue cycle. You bridge the gap between the clinical documentation and the financial outcomes. You ensure that the care delivered to the patients is accurately translated into billable data, which is vital for the sustainability of the healthcare services. And let me encourage you on something important. Your role is not just operational, it is strategic. You are not just coders, you are the problem solvers, compliance protectors, and the financial enablers. Every time you prevent a denial, correct a discrepancy, or improve the documentation, you are adding measurable value to your organization. Coding impacts more than just a revenue, more than just revenue. Accurate coding reduces the risk of audits, denials, and penalties. It strengthens the compliance, protects the organization reputation, and enables hospitals and clinics to reinvest in better technology, staffing, and patient care. And here's the another encouragement I want to share. Medical coding is a career with growth, respect, and global relevance. With continuous learning certifications and experience, you can grow into roles such as auditors, CDI specialist, compliance officer, educators, and RCM leaders. So, in today's session, we'll explore real world scenarios, including Abu Dhabi specific examples, to highlight how your work directly influences not only the financial performance but also patient outcomes and operational efficiency. By the end of this today's session, I hope you walk away not only with the knowledge but with confidence in your importance and pride in your profession. So let's get started, and always remember what you do is not just important, it is a foundational to the success of the healthcare. So let's start moving on to the first slide. These are the learning objects. First one, coding revenue impact. We'll explore here how coding touches every step of the revenue cycle from registration to payment posting. Second one is the common denials in Abu Dhabi. Here we'll understand preventable coding related denials and their financial impact on the healthcare organization. The third learning object we'll go on through is the documentation and compliance. Here we'll identify risk of poor documentation and how coders bridge clinical care with compliance requirements. And the fourth one is the strategic strengthening. Here we'll learn practical strategies coders use to protect revenue and improve the RCM performance. So let's understand now how coding impacts the entire revenue cycle. Let's begin by zooming out and look at a bigger picture. Often, people outside our field perceive coding as merely a process of assigning just number to diagnosis and procedures. But in reality, coding plays a crucial role in every stage of the revenue cycle. From the very moment a patient walks in the healthcare facility and registers, coding is influencing the accuracy of the information captured. As we move through the patient's journey, coding impacts how services are documented, how claims are prepared, and ultimately whether the healthcare organization gets paid promptly and accurately. Think of the revenue cycle as a chain, where every link depends on the strength of the one before it. If the coding link is weak, the entire chain can suffer, leading to delays and financial losses. And when coding is accurate, it ensures that the claims are submitted correctly at the first time itself. This leads to faster reimbursement, fewer delays, and fewer resubmissions. This in turn reduces financial loss and ensures that the organization can maintain its operations smoothly. On the other hand, inaccurate or incomplete coding can have the opposite effect. Even a small detail missed or an incorrect code can trigger claim rejection and compliance concern. This not only delays payment but also impacts the overall efficiency of the healthcare delivery. In some instances, a single incorrect code can delay payment for weeks or even months. And that doesn't just affect the financial side, it impacts the operation, staffing, patient services, and the overall sustainability of the healthcare delivery. So, throughout this session, I'll walk you through concrete examples that illustrate how coding decisions influence not just the billing team, but the entire healthcare organization. We'll look at the scenarios where proper coding led to smoother operations and where poor coding led to the cascading issues. By the end of our discussion today, I want you to understand that coding is not just a clerical task, but it is a critical financial and operational responsibility. It is a component that ensures the smooth functioning of the entire healthcare ecosystem. Now, let's look on to the second learning objective, that is the common denial in Abu Dhabi. Now let's identify some common coding related denials. Let's begin by exploring why coding related denials are such a critical issue in a healthcare system. Denials are more than just minor setback, but they directly impact the revenue flow and can drain your team's time and resource. In Abu Dhabi, we often see patterns of denials that arise from incorrect coding, mismatched codes, and missing or incorrect modifiers. For instance, let's consider a case where incorrect coding led to substantial delay in reimbursement for a local hospital. In this scenario, a simple coding error triggered a denial that required extensive appeals and administrative effort. We'll dive into the specific of such cases, examining what went wrong exactly and how it could have been prevented. We'll also address the impact of incomplete documentation. Missing documentation often leads to denial that require lengthy and costly appeals. We'll break down the types of documentation errors that commonly lead to denials, and we'll explore best practices for ensuring that documentation is complete and accurate. By learning from these real world examples, you will gain insights into how to anticipate and prevent these issues, turning potential losses into successful claims. In addition to identifying common pitfalls, we'll also discuss proactive approaches. This includes thorough training for coders, regular audits, and collaboration with clinicians to ensure that the coding is accurate from the start itself. By implementing these best practices, we can reduce the frequency of denials and streamline the revenue cycle. In summary, by learning from these real world examples and understanding from the root cause of denial, you will be better equipped to anticipate and prevent them. This is not only it is not only protecting the revenue, but it is also ensuring that your healthcare facility operates more effectively and more efficiently. Now let's look on to the third objective, learning objective, that is documentation and compliance. We'll recognize here how risk of poor documentation and compliance gaps are affecting. Now, let's shift our focus to documentation, which truly forms the backbone of accurate coding, right? The quality of documentation has a direct impact on the entire revenue cycle. Incomplete or poor documentation can lead to claim delays, payment reduction, compliance violation, and even the risk of audits are more. As coders, you're often the first line of defense in this process. You have a unique vantage point, allowing you to spot discrepancies and ensure that documentation is thorough and accurate. When documentation is strong, it ensures that the codes you assign are supported by the clear clinical evidence, reducing the likelihood of the errors and denials. So, in this session, we'll explore how to identify documentation gaps effectively. This includes recognizing when clinical notes are vague, incomplete, or inconsistent. We'll discuss the importance of thorough documentation and how it supports accurate coding and compliance. We'll also dive into strategies of communicating with effectively with the clinicians. Building strong relationships with the physicians or nurses and other healthcare provider is a key. By fostering open lines of communication, Coders can help clinicians understand the importance of detailed and accurate documentation. We'll also address today how to support compliance without adding unnecessary burden. It is all about striking a balance. We'll look at ways to streamline documentation processes and provide guidance to clinical staff so that everyone is aligned in maintaining high standards. Today, we'll also explore the impact of poor documentation on audits. Inadequate documentation can trigger audits, which are time consuming and costly. By ensuring robust documentation, we can minimize the risk of audits and maintain a smoother workflow. And finally, we'll discuss practical steps to enhance documentation quality. This includes training program, regular feedback, and use of technology to support accurate and complete documentation, right? And by the end of this session, you will have a deeper understanding of how documentation affects not just the compliance, but the overall efficiency and success of the healthcare organization. You will see how your role as coders is integral in supporting a compliant, efficient, and high quality healthcare environment. Now, the next learning objective we'll look on is on the strategic strengthening. We look to strengthening RCM through coding strategies and best practices. So, as we wrap up our exploration, let's dive into the strategies that empower coders to truly excel and strengthen the revenue cycle. First, let's talk about continuous education. The world of medical coding is dynamic, with guidelines and regulations constantly evolving, right? It is crucial for coders to stay updated with the latest coding standards, new ICD and CPT codes, and changes in the payer requirement as well. This ongoing learning ensures that coders maintain high accuracy and compliance, reducing the risk of errors and denials. Next, let's explore the importance of collaboration. Coders don't work in isolation. Building strong partnership with the other team, clinicians, and administrative staff is very, very essential. By working closely with these teams, coders can clarify documentation needs, they can address discrepancies early, and ensure that coding aligns with the clinical practices. This collaboration helps catch potential issues before they become a bigger problem. Ultimately, it improves accuracy and efficiency. Now, technology also plays a vital role in modern coding practices. Automation and analytics can significantly enhance the coding precision. Automation tools can handle repetitive tasks, reduce human error, and free up coders to focus on more complex cases. Analytics, on the other hand, help identify trends, spot anomalies, and provide insights that guide continuous improvement. By leveraging technology, coders can achieve greater accuracy and efficiency. Another key aspect is the use of performance metrics and continuous monitoring. By tracking key performance indicators, that is the KPIs, coders and healthcare organization can pinpoint areas for improvement, measure the impact of coding practices, and make data-driven decisions. This continuous feedback loops ensure that coding standards are consistently high and that the revenue cycle remains robust. Finally, let's not forget about the strategic role of coders. Beyond just being a technical task, coders are integral to the financial health and operational efficiency. By adopting these best practices, staying proactive, and leveraging technology, coders become the key players in ensuring that healthcare organizations thrive. By the end of this discussion, I want you to see that coding is not just about entering data. It is a strategic function that drives the financial success and operational excellence of the entire organization. So I close this section. By end of this session, my goal is very simple. I want you to take away with practical lesson that you can apply immediately, real examples that connect coding theory to the real world practice, a stronger understanding of your impact on revenue cycle, and most importantly, a renewed sense of pride in the work you do. Because as coders, you are not just processing claim. Let's take a moment to truly reflect on what that means. You are protecting a revenue. Every code you assign is not just a number or combination of letters. It represents the financial lifeline of the healthcare organization. When coding is accurate, hospitals get paid correctly. Departments can invest in better equipment. Staff can be hired and retained, and patient services can continue without any disruption. But when coding is incorrect, even slightly, it can lead to claim denial, delayed reimbursements, revenue leakage, and unnecessary audits. So, when you carefully review the documentation, clarify discrepancies, or follow coding guidelines to the letter, you are directly protecting the revenue. You are one of the strongest defenders of a hospital financial health. Also, you are supporting compliance. In today's healthcare environment, compliance is not just optional, it is essential. With constantly evolving guidelines like ICD, CPT changes, payer specific rules, government regulations, the risk of non compliance is always present. Every time you apply correct coding guidelines, when you avoid upcoding or undercoding, when you query providers appropriately, follow ethical coding practices, you are helping your organization. You're helping your organization by avoiding legal penalties, preventing fraud and abuse, maintain accreditations, and prevent its reputation. Compliance is not just a legal responsibility, it is a moral one. And you are at the front line of that responsibility. You are even sustaining a healthcare organization. Hospital and clinics do not survive on clinical excellence alone. They survive on the operational sustainability. Your work ensures that services rendered are properly captured, resources are reimbursed, care remains accessible, imagine a hospital with great doctors, nurses, and equipment, but due to this inadequate or poor coding, that hospital will struggle to survive. So when you show up each day and code accurately, consistently, and ethically, you are helping to keep that organization alive and functional. You are not behind the scenes, you are part of that backbone. You are ultimately supporting the patient care. This is the most sorry. Is the slides being shared? Hello? Okay. Uh, yes. Yeah. So you are ultimately supporting the patient care. This is the most powerful part of your role, and often it may be overlooked. When revenue flows correctly, hospitals can afford life-saving technology, staffing levels remain safe, quality initiative continue, and care remains affordable. So even though you may never touch a patient. Sorry. So even when you may never touch a patient, speak to them face to face, your work directly impacts their care. Every correctly coded claim helps ensure a machine is maintained, a nurse is on shift, every treatment is continued. In a very real way, you are helping patients receive the care they need. So coding guidelines and textbooks gives us the foundation, but your daily work is where the theory becomes more impact. For example, knowing sepsis guideline is a theory, right? Applying them correctly to avoid the DRG loss is a practice. Second, understanding modifier is a theory, but preventing denial using them appropriately is a practice. And it is in that practice that your true value shines. You have to be renewed in the pride with the work you do. right? Medical coding is often invisible, but its impact is not. You are problem solvers, revenue protectors, compliance champion, and silent partners in the patient care. So I want you to leave here today with pride, not just in your skills, but in your contribution to healthcare as a whole. Final thoughts I want to share with you here is, as coders, you are not just processing the claims, you are protecting revenue, you are supporting the compliance, you are sustaining healthcare organization, and ultimately you are helping ensure that patients continue to receive the care they need, and that makes your role not just important but essential. So let's continue to grow, learn, and elevate these professions together. Now let's move on to our next slide. That is the Abu Dhabi healthcare context. Now, the Department of Health sets strict rule for claims, approvals, and reimbursement. Electronic claim systems, treatment authorization requires stars, and detailed payer regulations require precision. Shafafia platform scrutinizes every submission. Small mistakes in codes, missing modifier, or unclear documentation results in immediate rejection. So, here in this slide, let's talk about the context in which we work. The healthcare environment here in Abu Dhabi. This environment is unique. It is highly structured, deeply regulated, and digitally driven, which means coding and billing here require not just the knowledge, but precision, vigilance, and accountability. Like, unlike many healthcare systems where processes can be flexible or loosely enforced, Abu Dhabi operates under a very clearly defined regulatory framework set by the Department of Health or the DOH. This framework influences everything we do as coders, from how claims are created to how approvals are taken or till how reimbursements are released. In other words, coding here is not just about choosing the right ICD or the right CPT code. It is about working within a system that is consistently monitored or audited and optimized. Now, let's look at the role of the Department of Health (DOH). The Department of Health in Abu Dhabi does not merely provide guidelines. It actively governs how healthcare revenue flows. Now, the department regulates how claim must be submitted, or how which codes are acceptable, which are not, which services require pre-authorization, or which documentation is mandatory, and how long reimbursement should take. The goal is very transparent. It is fair, it is sustainable, but for coders, this means there is a very little room for error. Every claim you submit is not just seen by a payer, it is potentially visible to regulators, auditors, and compliance team. So, when you code in Abu Dhabi, you are not just coding for a hospital, you are coding under a government regulated financial ecosystem. That alone elevates the importance of the role what you are doing. Now let's talk about the treatment authorization request stars. The precision is very mandatory. Let's talk about this star. Here, everything is digital. Claims are digital. Claims, authorization, rejections, corrections, payments. Sorry. This brings speed and efficiency, but it also removes the safety net of manual correction. Once a claim goes through Shafafia or the payer portal, the system immediately checks for diagnosis procedure compatibility, payer rules, authorization validity, modifiers, package rules, exclusion criteria. And if anything doesn't align, the claim doesn't wait. It gets rejected automatically, which means there must be a single wrong code, there must be a missing modifier, or there must be a mismatched diagnosis, or the authorization must have expired. So it can stop the entire claim in seconds. This is why in Abu Dhabi, coding accuracy is not optional, it is operationally critical. Now, I'll talk about challenges coders face here. Let's be honest, the challenges here is real. High scrutiny. Every claim is scrutinized. by payer systems, by hospital audit teams, by external regulators. Even experienced coders face unexpected rejections, rule changes, system updates, and payer specific quirks. It means your work truly matters here. Complex payer rules. Now, each payer has its own medical policy. Coverage, it must have its own coverage limitations. It must have its own authorization requirements and exclusions. So, a code that works for one payer might be rejected by another. This means coders here must go beyond the general coding knowledge and develop payer literacy, policy awareness, and strong problem solving skills. Right? Now, next is the documentation gaps. Even in the advanced hospital, physician documentation is not always perfect. Coders have to interpret unclear notes, query the physician, clarify the intent, and ensure documentation supports billing. This is actually not easy a task, but it is one of the most critical parts of your role. Now, let's see the opportunity where coders directly influence the financial performance, because this is where Abu Dhabi becomes the most exciting for coders. In this environment, coders directly influence the financial performance of the hospital or clinic. Like when coding is accurate, claims go through faster, denials are getting reduced, cash flow improves, AR days increases, and revenue like leakage is minimized, which means your work impacts the monthly revenue, the quarterly targets, and the annual financial health. In Abu Dhabi, coders are not distant from finance. You are the key financial driver, even if you don't sit in the finance department. That is one of the powerful position. Now let's look onto the Shafafia platform where the value of coders become more visible. Here, everyone working in Abu Dhabi healthcare might know the system. We have all experienced entering a claim carefully, submitting it, and then receiving a rejection for something that seems very small, like diagnosis mismatch, where the services might not be covered. There might be a missing authorization or an invalid modifier. And that's where the value of coders become very clear, because the system does not care about effort, it only cares about accuracy and compliance. Coders are the professional who understand both clinical language and the payer rules. They can identify why a claim failed and know exactly how to correct it. We are not just fixing claims, we are interpreting rules, translating documentation, and protecting the revenue. Coders are the bridge between clinical care and compliance. One of the most important thing to understand about your role in Abu Dhabi is you are the bridge between physician documentation and compliance. Doctors might focus on diagnosis, treating, and saving life, but they are not trained in payer policies, coding guidelines, or reimbursement rule. That is where you come in. You take what doctors write and then you transform it into valid codes, compliant claims, and reimbursement services, right? Without altering the truth, without exaggerating much, without underreporting. This is a highly skilled translation process. And without coders doing this correctly, even the best clinical care may never be paid for. One more thing I want to specify, coders are not just a data entry personnel. This is a myth and that must be broken. In Abu Dhabi healthcare system, coders are the analysts, compliance officers, revenue protectors, and process optimizers. You are making decisions that affect audit risk, revenue, and regulatory standing. Data entry follows rules blindly. Coders apply knowledge, judgment, and ethics. And that difference is very enormous. Compliance, it is a strategic advantage and not it is not just a requirement. In Abu Dhabi, compliance is not just about avoiding penalties. It is a strategic advantage, like the organizations that code accurately, follow the DOH rules, maintain clean claims, and pass audit easily. It attracts the better payer contracts, stronger reputation, and international credibility. So, when you code correctly, you are not just protecting your organization from trouble, you are helping it grow and compete. right? And sustaining the patient care. Let's connect let's connect to the patient. This connect to the patient side. When revenue flows smoothly, hospital invest in technology, they expand their department, they improve their staffing and maintains the quality. But when the claims are delayed or denied, the cash flow suffers, budgets get tightened, and the patient services are impacted. So even though coders rarely interact with patients, your determination determines how sustainable patient care truly is. You are the part of the care delivery system, just from a different angle, right? So when you think about coding in Abu Dhabi context, remember this. Every code you assign carries the weight of compliance, the responsibility of financial health, and the sustainability of the patient care. Your accuracy is not just technical, it is strategic, it is essential, and it is valuable. And that is why coders in Abu Dhabi are not just a support staff, they are the key players in the healthcare ecosystem, right? Now that we understand that the Abu Dhabi healthcare system and the health and the environment we operate in, let's turn our attention to how we'll approach the rest of today's discussion today. Instead of saying in a vague theory, I want this session to be practical, real, and directly applicable to your daily work. Because when you walk out of this room, I don't want you to just feel inspired. I want you to feel equipped. So we'll focus on the five areas. Let's move on to the next slide. So we'll focus on these five areas, five pillars that define how coders strengthen the revenue cycle management and protect the financial health of the healthcare organization. Let's begin with the first and perhaps the most overlooked pillar, that is the hidden RCM drivers. Coders work behind the scenes but protect hundreds of thousands of dirhams through accurate coding. Let's start with something very important, recognizing who we really are in the revenue cycle. Coders are often invisible. They sit behind the screen, we analyze the documentation, we assign codes, we validate claims, and most of our work happens quietly. Patient may never know your name. Doctors may not fully see your role. Even management sometimes only notices coding when something goes wrong. But even though our work may not always be seen, its impact is very enormous. Every accurate code has a financial power. Let's think about what happens every time you assign a correct code. That one code supports cleaner claims, it prevents the unnecessary denial, speeds up the payment, protect hospital revenue, and when you multiply that by suppose 50 claims by a day or 200 claims a day or thousands of claims a month, you begin to see something powerful. Like coders not don't just support the RCM, coders drive RCM because RCM cannot function properly if coding is weak, right? You are the first line of the revenue defense. In many cases, coders are the difference between getting paid fully or losing thousands of dirhams. Let me share a real situation many of us have must seen in the hospitals. Like a coder identified undercoded procedure and helped recover massive lost revenue. Not by doing anything unethical, but by ensuring that what was done clinically was accurately captured financially. There must be like a coder corrected documentation gap that could have triggered audits by DOH or payers, protecting not just the money but the hospital reputation. And a coder prevented a repeated claim rejection simply by ensuring that a diagnosis matched payer rules or whether the procedure was authorized or whether the codes aligned where the codes were aligned with the Shafafia requirement. These are not small wins. Sometimes coders protect hundreds of thousands of dirhams simply by being diligent, right? Simply by being careful and committed to quality. That is not data entry, that is a financial stewardship. Why coders are often overlooked and why that must change? Because when things go right, Claims pass, payments come. Nobody asks a question. But when things go wrong, denials appear, delays happen, suddenly coding becomes visible. So the truth is like when coding is strong, problems never happen. And that silence is actually your success. That is why coders are the hidden drivers. You create stability, not noise. And stability in the revenue is one of the most valuable thing a healthcare organization can have. Let's be very clear about this, that you are not just a support staff, not just a back end worker, or just a claim processor. You are the revenue defenders, you are the compliance protectors, you are the financial guardians. Your decision affect the audit risk, revenue leakage, AR days, cash flows, and payer trust. That places you firmly in a strategic role and not an operational one. Even if your job title says coder, your function is far, far, far more bigger. Now, let's look how coders influence the hospital performance quietly but powerfully. When the coding is strong, denial rate drops, rework reduces, finance team spends less time in fixing the errors, cash flow becomes predictable. When on the other side, when coding is weak, finances chases claims, management pressures the teams, compliance risk increases, and the staff burnout rises. So coders don't just protect revenue, they protect the organizational efficiency and morale. That's impact beyond numbers. In Abu Dhabi, this role is even more critical because claims are highly regulated. DOH audits are real. Payers enforce strict medical policies. Shafafia rejects instantly, and compliance is non-negotiable. In such environment, coders are the gatekeepers. You decide what enters the system, how clean it is, and whether it survives the payer scrutiny. Few roles carry that kind of influence. And there should be a shift in mindset from I just code, and it should be to I protect the revenue. I want to challenge one common mindset like I just code what is documented. Instead, you think that I ensure what is documented becomes reimbursable, compliant, and defensible. That small shift changes to how carefully you review the documentation, how confidently you query the physician, how responsibly you treat your role. And that mindset is what separates average coders from the exceptional coders, right? Now, coders maybe they are like these silent leaders in RCM. You may not manage people, you may not be present in boardrooms, but you lead through accuracy, consistency, and ethics. And leadership in RCM is not always loud. Sometimes it is quiet, consistent, and deeply reliable. That is the kind of leadership coders bring. Now, final thought for this pillar I'd like to share. When talking about strengthening the RCM, remember one thing: you are the foundation, you are the safety net, and often the final checkpoint. You might not be seen always, sorry, but you are always essential. And every healthcare organization that succeeds financially does so on the back of the strong discipline and ethical coding. Now let's look on to our second discussion, is the denial management. A second focus is one that every coder here is familiar with: denials. Denials are one of the biggest pain points in both outpatient and inpatient settings. They slow down the payment, they increase the rework, they create pressure from the management, and it leads to a frustration across the coding, billing, and the other teams. But here is the most important message I want you to remember: a large percentage of denials are preventable, and that is exactly where coders play a powerful role. Denial, like many people might assume, denials are only a billing issue, but in reality, denials begin long before billing. They begin at coding, because the quality of a claim is built at the coding stage. If the code is wrong, or if the code is incomplete, or if it is unsupported or misaligned with payer rules, The denial is already written even before the claim is submitted. So denial management is not just about fixing the rejected claim. It is about preventing revenue leakage before it happens. Now, I'll discuss with you some of the common coding related causes of denials. It first might be the incorrect CPT or ICD coding when the wrong procedure is selected, or when the diagnosis does not reflect the true condition, or the code does not match the service level. The payer rejects the claim as incorrect coding, invalid diagnosis, or inappropriate service. Even a small mistake can delay payment by weeks or result in a total non-payment. Now, second, it is a missing modifier or incorrect modifier. Modifiers may look like small additions, but in reality, they often determine whether a claim gets paid or rejected. Common issues are missing modifier, or incorrect use of modifiers, or the wrong laterality, or modifier conflicts. One missing modifier can truly turn a perfectly valid services into a denied claim. Now, next might be a diagnosis that is not supporting the medical necessity. This is one of the most frequent reasons for denials here. Like when the diagnosis does not justify the procedure or does not meet the payer medical policies. The payer sees the service as not medically necessary. Even if the service was clinically justified, if the coding does not reflect, that payment is denied. Sometimes the documentation is correct, but the code does not fully reflect what is written. Or the codes are correct, but the documentation does not clearly support them. This gap is really very dangerous because in audits, payer don't just check codes. They verify whether documentation truly supports them. In Abu Dhabi, especially, each pair has its own rule. Each has their own coverage criteria, exclusion, and authorization policy. A code that is accepted by one pair may be rejected by another. Coders who do not adapt coding to pair specific rules unintentionally they invite denial. Let's be from reactive to proactive. Here is where coders truly transform the denial management. Instead of reacting to denial, coders can prevent them, like by identifying patterns, sorry, understanding the root cause, and acting before the claim is submitted. That's the difference between chasing denied claims and then submitting the claims. Let me share like one of the real type scenario that we have experienced. Many of you must have experienced, like identifying recurring denial trends. Coders noticed like the repeated denials for the certain radiology procedure, rejection due to diagnosis mismatch. Instead of resubmitting blindly, coders analyze the trends, identify missing medical necessity codes, adjusted the diagnosis selection, and educated the referring physician. What were the results? The results were like denial rates dropped significantly, the payments were faster, and the reworks were really very less. Second example I can share with you is the adjusting coding workflow. Coders observed frequent rejection due to missing modifier. They updated the internal checklist, added modifier verification before submission. What were the results? It was like cleaner claims, lower rejection rates, and higher first pass yield. Third example I can share you is educating the clinical teams. Sometimes the issue is not coding, it is the documentation quality. Coders work with physician, explained how documentation affects payment, clarified what payers require. What were the results? The results were like better documentation, stronger core support, it reduced the audit risk. This is where coders go beyond the technical work and they become educators and collaborators. Every denial prevented has a real value. Now, let's talk about what happens when denial is prevented. When denial is prevented, revenue is protected, time is saved, stress is reduced, and productivity improves. Every prevented denial means one less claim to chase, one less appeal to write, or one less follow up email. Multiply that across hundreds of claims, and you can clearly see the impact of the coders you have on the organization. Also, denial management is a coding excellence issue. Denial management is often viewed as a separate department, but in reality, it is deeply connected to coding excellence. Strong coders think beyond the code, anticipate pair behavior, and protect claims before submission. That is what separates coders who process from coders who protect the revenue. Now, final message I would like to give to this pillar, like remember, denial is not about just the willing or the coding failures. They are often preventable coding opportunities. And every time you prevent a denial, you are protecting the revenue, you are improving the efficiency, and you are strengthening the entire revenue cycle. So denial management is a core part of coding excellence, and as coders, that puts you right at the center of the revenue protection. Now let's look on to the third uh, key area, that is the documentation integrity. Our third key focus area here is documentation, because no matter how skilled coder you are, coding quality can never be stronger than the documentation behind it. You can have excellent coding knowledge, you may have deep pair understanding and strong compliance of awareness, but if the documentation is weak, unclear, or if it is incomplete, the claim is already vulnerable. Why documentation is the true foundation? Let's be very clear about this. Every claim begins with documentation. Before a single code is assigned, before a claim enters the Shafafia, or before a pair ever reviews it, the foundation is already set by what the physician documents. And if that foundation is shaky, even everything built on it becomes unstable. When documentation is poor or incomplete, it can lead directly to claim denial because payers cannot verify the medical necessity or appropriateness of the care or service justification. Delayed payments because claims are sent back for clarification, queries are repeated or stuck in rework loops, and compliance risks are there because unsupported codes raise red flags for overbilling, underbilling, or improper billing. Audits exposures are there because auditors don't just check codes, they examine whether documentation truly supports them. So documentation is not just a clinical record, it is legal, it is financial, and it is a compliance document. This is where we redefine the coder's role. Coders are not just translator of notes into numbers. Coders are the documentation reviewers, quality checkers, they are the educators, they are the collaborators, right? You are often the last professional to see the clinical record before it becomes a financial claim. That means you are the final gatekeeper of the claim integrity, right? Every time you open a chart, you are checking, does the diagnosis clearly support the procedure? Is the laterality specified? Is the severity documented? Is the procedure fully described? Is the medical necessity clearly reflected? Because you are not just coding, you are validating whether the story makes sense. And when it doesn't, you don't guess, you query. That protects the organization, the physician, and yourself. Like coders might silently improve documentation quality every day by day by flagging the missing details, by identifying the unsupported billing, and strengthening the clinical narratives. In doing this, you reduce the audit risk, you improve the defense claim defensibility, and you elevate the hospital credibility. That is quality assurance and not just coding. Sorry. One of the most valuable thing roles coders play is education. Coders help physician understand what needs to be documented, why certain details matter, and how documentation affects both patient care and reimbursement. For example, why chest pain is different from unstable angina, or why infection is different from sepsis, or like why procedure done is not enough without findings and techniques. When coders communicate this effectively, documentation quality improves at the source, and that reduces problem downstream. The strongest healthcare organizations are not only built on isolated departments, they are built on coding teams working with physicians, with clinical documentation improvement, CDI, with compliance, and with billing. When both our coders and physician, when they work together, the claims become more stronger, reimbursement becomes more smoother, compliance becomes safer, and audits become less threatening. This collaboration transformed documentation from a routine task into a strategic advantage. Now let's see like why documentation integrity matters even more. So in Abu Dhabi, highly regulated environment, sorry, DOH audits are strict, payers are payers are vigilant, and electronic systems enforce validation rule, which means weak documentation does not survive scrutiny. A vague note that might pass in another system can fail immediately here. So documentation integrity is not optional, it is essential for the survival in this healthcare ecosystem. It is not just clinical, it is strategic. Let's change how we think about documentation. It is not just a clinical record or a treatment note, it is a legal document, a financial instrument, and a compliance shield, which makes documentation integrity clinical, financial, operational, strategic all at once. Now, final message I would like to give for this pillar is like remember one thing. Coding does not begin with codes. It begins with clear, complete, and compliant documentation. And coders are not passive recipient of documentation. We are the guardians of its quality, the translator of its meaning, and the protectors of this its integrity. When documentation is strong, claims are stronger, revenue is protected, compliance is safer, and the organization becomes more resilient. That is why documentation integrity is the foundation of every claim, and coders are the ones who keep the foundation solid. Now, let's move on to the next key area, that is the technology and automation. Here, our fourth discussion area is one that generates both excitement and anxiety at the same time in the healthcare coding, technology and automation. Today, we are working in an environment filled with AI assisted coding system, claim scrubbing tools, automated edits, advanced electronic health records, and real time validation system. These tools are powerful. They increase efficiency, they reduce the manual workload, and they help identify errors faster than ever before. But here is the key message I want to clearly communicate. Technology is a partner to coders. It is not a replacement for coders, right? What technology does well is I'll start by acknowledging what technology does very well. Like it can suggest code. AI system can analyze documentation and propose likely ICD or CPT codes. It can identify the patterns or speed up the initial code selection. This can save time and help coders to focus on validation rather than manual searching. Like it can flag the potential errors. Claim scrubbers can catch the missing modifier, identify invalid code combinations, or alter mismatched diagnosis procedure pair. This reduces basic mistakes and improves the first pass acceptance. It is the highlight missing element. System can prompt missing physician signature, absent authorization number, maybe the incomplete demographics or documentation gaps. These are extremely valuable safety nets. It can improve efficiency. Automation allow coders to handle higher volumes, spend less time on repetitive tasks, and focus more on complex cases. All of this is positive, right? But technology is not the enemy. Inefficient use of technology is. What technology cannot do, now let's talk about how what technology cannot replace, because this is where coders remain absolutely critical, like interpreting complex clinical nuance. Technology struggles with complex multi-system conditions, overlapping diagnosis, conflicting documentation, or evolving patient conditions. For example, AI may suggest sepsis based on keywords, but a coder must determine whether it is truly clinically supported or just mentioned as a rule out. That requires clinical understanding, not pattern recognition alone. Second, it might understand pair specific behavioral patterns. Technology can follow the rules, but coders can understand the behavior. For example, which pair frequently reject certain codes, or which require extra documentation, or which demand stricter medical necessity. These insights come from experience or the pattern recognition and real world exposure, not only just algorithms. By it can also now the technology can apply judgment in ambiguous situation, like what happens when two diagnoses are equally documented, like what happens when a procedure description is unclear or documentation is contradictory. Technology freezes or chooses blindly. Coders can analyze, interpret, clarify, and decide responsibly. That is human judgment, and it cannot be automated. A technology can protect compliance with contextual awareness. Technology check whether the rules are followed. Coders ensure whether the claim is defensible. A claim may pass system edits, but still fails in an audit. Coders think beyond, like, will this pass today? They'll ask, like, will this survive an audit tomorrow? That level of foresight is human. The strongest model is technology plus human expertise. The future of coding is not technology versus human, it is technology plus humans. The strongest revenue cycle system are built when automation reduces the errors and coders ensures integrity. Together, these both create cleaner claims, safer compliance, faster reimbursement, and lower denial rate. Real examples when technology helps and when coders save the day. Let's look on both the sides. For example, where automation helped, a hospital implemented claim scrubbing software that caught the missing modifier or identified the invalid code pairing and flashed the unbundled service. Result was like immediate reduction in the front end rejection, sorry, higher first pass yield, less manual work. Technology clearly enhanced the performance. Second example where I can give is where coders caught what technology missed. An AI tool suggested higher ENM level based on documentation keywords, but the coder noticed medical decision making did not support that level and documentation lacked complexity. If the AI suggestion had been accepted blindly, it could have resulted in overcoding and audit risk. The coders corrected it, protecting the compliance, reputation, and financial integrity. That is the irreplaceable human layer. Now, why coders should embrace and not fear the technology? There is a common fear, like, will the technology replace coders? The truth is, technology replaces the repetitive task, not the critical thinkers. The more technology evolves, the more coders are needed to validate, interpret, oversee, and guide its use. Coders who learn the technology, adapt to automation, and use tools effectively will not become obsolete at all. They will become more valuable, right? So let's change the narrative. Coders are not the victims of automation, they are controllers of the automation. You decide when to trust the system, when to override, when to query, and when to escalate. That put coders in a position of authority and not weakness, right? In Abu Dhabi, systems are highly automated, claims are digitally validated, and payer rules are system enforced, which means coders must be both technologically skilled and clinically aware. You cannot rely only on the system or only on your instincts. You need both. It should be working together, right? So, the final message on this pillar I would like to give is technology is not here to replace the coders. It is here to amplify the coders. The future belongs to coders who understand the technology, trust their judgment, and use both of this wisely. Because when technology plus human expertise work together, the revenue cycle becomes more stronger, it becomes more safer, and it becomes more smarter. And that is exactly where coders belong and at the center of that partnership. So let's move on to our last key discussion, the performance KPI. Finally, let's turn to our fifth focus here. It is the KPI, key performance indicator. We are not discussing KPI to pressure anyone. We are discussing them to reveal something very important: the real measurable value of coders. Because for a long time, Coding has been a back end function. KPIs change that narrative by turning invisible work into visible impact. KPI tells a story, not just number. KPI are not just numbers, not just percentage or spreadsheets. They are evidence of impact. They tell the leadership where the revenue is protected, where the systems are efficient, and where improvement is needed. And most importantly, they show how coding directly influences the financial health. Now let's look on to the most important KPI connected to coding, the first pass claim rate. This measures how the claim get paid the first time without rework or rejection. At high first pass rate means coding is accurate, documentation is aligned, payer rules are respected, and claims are clean. When coders perform well, first pass race increases, finance team chase fewer claims, cash flow becomes more predictable. This is one of the clearest indicators of coding excellence. Next is the denial rate. Denial rate shows how often claims are rejected by payers. When denial rates are high, it usually points to the coding errors, documentation gaps, or the payer misalignment. When code is improved, denials decreases, rework reduces, and stress among the team drops. This metric directly reflects how well coders are preventing the revenue leakage. Now, the KPI measures how long it will take for a hospital to get paid. Coding impacts this more than most people realize. When coding is accurate, claims move faster, less back and forth occurs, and payments arrive the sooner. So when AR days reduce, cash flow improves, financial planning becomes more easier, and the organization becomes more stable. Coders play a silent but powerful role here. Next is the rework rate measures. How often claims must be corrected and resubmitted. High rework means errors at the front end or weak documentation or misaligned coding. When coders are strong, rework drops, productivity increases, and the operational waste reduces. Lower rework means less frustration, more efficiency, and better morale. Now, let's look how accurate coding improves all KPI together. When coding is accurate and compliant, first pass rate increases, denials decreases, AR days shorten, and rework reduces. It also stabilizes the revenue. This is not coincidence. This is not a cause, and this is a cause and an effect. Strong coding creates strong KPI. These metrics help leadership understand something critical like coders are not the cost, coders are the revenue generators and protectors. Without strong coding, revenue become unstable, compliance risk increases, and financial planning become unpredictable. And with the strong coding, revenue is protected, audits become safer, and organizations grow confidently. And this KPI transform coders from expense to investment. Now, what powerful is that that coder KPIs impact more than just the money. They can impact on the compliance integrity, operational efficiency, staff workload, and ultimately the patient care sustainability. Because when the revenue flows correctly, equipment is upgraded, staff is retained, services are expanded, and quality improves. So KPIs don't just reflect the coder performance, they reflect how well the entire healthcare system is functioning. Like in tell you like why KPIs matter even more here in Abu Dhabi, where like the payers closely monitor performance, DOH evaluates the compliance, and hospitals compete on quality and efficiency, which means stronger KPIs give organization a strategic advantage, and coders are directly influencing those numbers every single day. Bringing it all together, throughout this session, we will be sharing the real life stories and examples from hospitals and clinics across the UAE. Not theory, not assumption, but real situations where coding decision protected the revenue, prevented financial loss, avoided audit exposure, and strengthened compliance. These are the stories where coders made a difference. And through everything we discussed today, RCM impact, or it might be denials, documentation, technology, and the KPI, one message should be very clear. Coders are not just a part of revenue cycle, coders shape the revenue cycle. Final closing thought I would like to give you: as coders, you are the revenue defender, compliance protector, and silent partners in the patient care. And through KPI, your impact finally becomes visible, not just as number, but as a proof that what you do truly matters. So as we move forward, keep in mind these five discussion area. They will guide our conversation and highlight that the critical role of coders play in strengthening the revenue cycle, protecting revenue, and supporting the delivery of the quality healthcare. Now let's move on to the next slide. Coders, the air traffic controllers of the healthcare. I love using this analogy because it is so visual and intuitive. Think about the passengers on a plane. They don't see the they see the pilot and the cabin crew. They meet the ground staff, but they almost never see the air traffic controllers, right? Many passengers don't even think about them. Yet without the air traffic controllers, plane cannot land safely, flights cannot move efficiently, chaos would happen in the skies. Now let's translate this to healthcare. Coders are like the air traffic controllers of the revenue. Coders direct the flow of claims, ensure every detail is correct, align clinical documentation with payer expectation, prevent financial crashes such as denial, rejection, audits, and revenue and loss of revenue. Every time you assign the right code, clarify your documentation gap, or correct an error before submission, you keep the revenue cycle flying smoothly. Pause here and ask yourself: have I prevented a financial crash this week by catching something early? That is not a clerical work, that is mission critical work. Now, I would like to share some example related to outpatient setting. In a busy cardiology outpatient clinic, multiple procedures were being coded incorrectly for months. Claims were still going out, payments were coming but not in full. Revenue was being lost every single day, quietly behind the scenes. One of the coder decided to investigate. Instead of just processing claim mechanically, they reviewed the claim pattern, compared the reimbursement, noticed a recurring error which is with a specific combination of procedure and modifier. Then they took action, investigated the root cause, corrected the coding structure, collaborated with physician to improve the documentation, trained the administrative team on the correct process. What happened? Within a few months, the clinical record tens of recovered a tens of thousands of dirhams, claim accuracy improved dramatically, denials decreased, and revenue stabilized. Now, pause here for an emphasis. This just wasn't a luck. It wasn't automation. It wasn't a coincidence. It was the value of a skilled, attentive, and a proactive coder, right? Another key role coders play is preventing the domino effect of mistakes. One small error can create multiple claim denial, extra workload for the billing teams, resubmission and appeals. It can increase the administrative cost, delayed payments, and compliance red flags. Suddenly, a small oversight multiplies into hours or even weeks of work, not just for coding or for billing, finance, and management, but when coders catch issues early, problems stop immediately, claims flow smoothly, revenue is protected, and teams avoid unnecessary stress. Coders don't just fix the claim, we prevent problems before they start. Think of a time you caught an error early. Like how much work did that save the team? How much time of work did you save of that team? That is strategic value, not operational noise, right? Beyond revenue, coders safeguard something equally important like compliance and reputation. Incorrect coding can lead to audit risk, regulatory penalties, legal implications, trust issues with the payers. In highly regulated environments like in Abu Dhabi, this is critical that coders ensure ethical billing, they prevent the accidental misuse of codes, maintain regulatory alignment, support transparent and compliant healthcare delivery. The coders just don't protect the money, we protect trust, credibility, and institutional integrity. Now, just for a reflection, just think like how does your work contribute to the hospital reputation every day? Let's emphasize this because it is often misunderstood. Coders are not just a data entry staff, clerical workers, people who just type numbers. Coders are analysts, auditors, problem solver, financial guardians, and compliance partners. Every day, coders evaluate the documentation, apply complex rule, interpret pair policy, and ensure accuracy and defensibility. This requires medical knowledge, policy understanding, critical thinking, attention to detail, and professional judgment. An expertise like this directly impacts hospital sustainability. So, when we talk about coders as a hidden RCM drivers, remember this: even though we often work behind the scene, even though our work is not always understood, even though our names rarely appear in the reports, our impact is everywhere. Every correctly coded claim, prevented denial, recovered dirhams, avoided compliance risk, and it is a proof that coders are essentially drivers of financial health, operationally efficiency, and compliance success. Coders are not just a part of the revenue cycle; coders power the revenue cycle, and that's make each one of you as a key contributor to sustainable healthcare, quality in patient care, and financial and operational resilience. Now let's look on to our next slide. Denial management, stopping revenue leaks. Here, let's move, one of the most critical battleground of the RCM, that is a denial. Across the world, denial rates commonly sits around 10, might be 20%, but here in Abu Dhabi, the challenge is even greater. Why? Because our ecosystem operates under strict payer rule, Department of Health Regulations, DOH, and highly structured Shafafia platform. This means even the smallest deviation in coding, documentation, or medical necessity or authorization can lead to denial. Denials are often underestimated, like people might sometimes think like it is just one claim, it is just one rejection, but denials are like small leaks in a massive pipeline. One drop doesn't matter. Hundreds of drops every day, hundreds of drops a day, or might every day across months, that turns into millions of dirhams lost. Here's the critical truth: like every denial represents work that has already been done. The consultation which was happened, the procedure was performed, the resources were used, but the organization doesn't get paid. That's why denials are not trivial. They are real, measurable financial impact. Now let's talk about the common, I'd like to share the common coding related causes of denial. First one is upcoding, assigning a higher code than documentation supports. Next is the unbundling, separating services that should be grouped. Insufficient documentation, incomplete or non-compliant notes, medical necessity issues, diagnosis is not supporting the procedure, or mismatch between the diagnosis or procedure. Or it might be repeated patterns not being flashed early. These are not clerical mistakes. They create a real financial damage, sometimes silently over the months. Now, I would like you all to take a moment to think about your facility. What is the common denial you see? Is it the documentation related, or is it concentrated in a specific specialty like orthopedic or emergency or cardiology or pediatric, or it is just a pair specific? Like just reflect for your just for a mental reflection. I would like to share an example. This can capture perfectly. In one clinic, patient after patient was repeatedly document simply having chest pain. Now, chest pain is not a diagnosis; it is a symptom. But pair here demands specificity. One of our coders noticed this repeating trend. Instead of ignoring it, the coder raised a clarification query, engaged the physician, educated them on the importance of specificity, ensured better clinical documentation going forward. Now, after discussion, the diagnosis was clarified as acute myocardial infarction, a serious life threatening condition. That single act did three incredible things: prevented a denial, ensured correct and fair reimbursement, enhanced patient safety by reflecting the true condition in the record. This is where the power of coders become clear. We don't sit at the end of the revenue cycle anymore. We are now a preventive force. Every denial avoided stops a ripple effect that otherwise creates a more more workload or for billing, extra administrative time, appeals, corrections, resubmissions, delayed revenue, and compliance risk. When coders analyze the trends, questions unusual cases, and work closely with physician, and while they strengthen the documentation, we are not just coding, we are protecting millions in revenue silently and strategically. In many organizations, denial management is reactive. A claim is denied, only then do teams start working on it. High performing organizations do something different. They analyze the pattern, identify the root cause, educate the teams, strengthen the documentation, build collaboration between coders, billing clinician, and the RCM team. This shift the culture from fixing denial to preventing the denial. That shift is what differentiates top performing revenue cycle from the struggling one. Now, every denial avoided is not just a financial win. It is proof of coding in excellence, proof of collaboration with the clinician, proof of compliance strength, and proof that coders are vital to business success. Coders do not just support the revenue cycle, they stabilize it, protect it, and optimize it. We are the quiet guardians ensuring hospitals and clinics remain financially strong. So I would give a closing thought on this. So the next time when a denial is avoided, remember behind that success is one of the coder. Behind that compliant, maybe it's a coder. Behind that recovered revenue is a coder. Coder are not only just processing claims, we are protecting the financial health, ensuring compliance, and contributing directly to a better patient care. And that is why coders are essential leaders in the denial management. Now, I would like to ask, or I would like to share, like, think of the last time your coding work prevented a denial or recovered a revenue. How did that impact your team or the patient care? This reinforces pride and ownership in the work. Like, I would now share some key takeaways from this segment. Like, denials are financially significant, small leaks in a pipeline that adds up. Many denials are preventable through accurate coding and documentation. Coders stop problem before they cascade, saving time, stress, and money. Coders are strategic partners in RCM, not just the clerical staff. Shifting from reactive to proactive, denial management protects revenue and strengthens the compliance. Let's turn on to our next slide. That is the documentation. It's about the documentation integrity. Here, let's talk about something that sits right at the heart of the coding and the revenue cycle management. Something that determines whether a claim is paid smoothly or it is denied instantly. Documentation integrity. It's about the documentation integrity. Because no matter how skilled a coder, how skilled a coder might be, no matter how advanced the RCM system is, we can only code what is written. If the documentation is incomplete, if it is unclear or missing clinical justification, then even that best coder in the world cannot rescue the claim, right? Let me ask you something like how many of you have ever looked at the documentation and thought this treatment makes sense clinically, but does the documentation support it financially? Give a thought on this, right? Exactly, like this is the reality we live in every day. Huh? So here, why documentation integrity is critical in Abu Dhabi is because the stakes are even higher. Many denials from payer and DOH audits written with the same phrase, medical necessity not met. Now, pause here. Most of the time, this does not mean the care was wrong. It means the story was not told properly. It means the documentation did not justify the service. It did not explain the patient condition clearly. It did not link the symptoms to diagnosis, or it didn't show why treatment was necessary. And in healthcare finance, if it is not documented, it did not happen. Like, think about your organization for a moment. Where do you see documentation weakness most? Or is it do doctors document symptoms instead of conditions? Are notes too short or is it just copy pasted? Just reflect. Every detail has a cost, right? And why specificity matters is like let's look on to a simple example. A provider writes only fever, and that is one word is not enough. A payer will ask fever due to what? Viral or bacterial? Is it related to infection? Is it due to post operative? Is it immunological? It is acute or chronic associated symptoms. And every detail affects the ICD coding, claim justification, reimbursement approval. Without specificity, the claim is at risk, and clinically, the patient record is incomplete. Now, here is a real example from a specialty center in Abu Dhabi. The denial rate was 25% every month. Worst affected department was, for example, I can give you as pediatric. Most common documentation, a single word like diagnosis like a fever, coughing, vomiting. Coders examined the trends and identified the cause root. Documentation was incomplete. But instead of staying silent, instead of just processing the denial, or instead of just accepting it as normal, the coder stepped up, met the physician, explained why specificity is essential, demonstrated with example like acute viral fever versus fever, acute bronchitis versus cough, dehydration secondary to gastroenteritis versus vomiting. The educated physician on payer expectation showed denial patterns and financial impact. This is not confrontation, this was collaboration. And the results were more powerful. The denial rates dropped, the first pass claim rate improved, revenue improved significantly, rework decreased, compliance risk reduced, and physician began documenting better naturally. This is the power of documentation integrity. This is the impact of coders stepping up as partners in both quality and finance. Now, this example teaches us something critically like coders are not just people who assign just codes. They are not just the administrative staff. They are educators, auditors, collaborators, financial guardians, and quality champions. We help physicians understand why their word matter, how documentation impacts the payment, how it influences the compliance, how it reflects the patient care quality. Like we build bridges between the clinical care and the financial performance. When documentation integrity is strong, it improves the faster reimbursement, fewer denial, higher FPCR, less operational stress, stronger compliance, clear patient records, better clinical opportunity, and better clinical continuity as well. This revenue cycle becomes smoother, teams become more aligned, and healthcare organization becomes financially healthier. Now, here is the key message I want to give is that documentation is not just a doctor's job. Documentation is not just the coder's problem. It is a partnership. Coders are the bridge. When coders work closely with clinician, guide, educate, and collaborate, then documentation strengthens, compliance strengthens, revenue strengthens, and most importantly, patient care is better supported, better justified, and better protected. Now, I would like to ask for just for reflection. Think of one case in this month where you clarified documentation and prevented a denial. How much impact did that create for the patient and for revenue? This must reinforce pride, ownership, and the strategic value. Okay. Now, let's move on to the next slide. Sorry. AI plus coders, the perfect partnership. What AI does well: process larger volume quickly, scan records and suggest code, identify patterns efficiently, and what coders provide: clinical judgment and context, payer specific rule interpretation, and compliance of oversight and accuracy. Now, here, healthcare is evolving very fast, and coding is no exception. Here in UAE, we already see tools like AI assisted coding, predictive denial model, dashboards that track coding accuracy in real time. And as I told you early, will AI replace coders? The short answer is no, AI will not replace the coders. In fact, AI need coders more than ever. Why? Because AI is powerful, but it is not that perfect. AI can scan records quickly, it can identify the keywords, it can suggest the possible codes, process thousands of claims in seconds, detect patterns faster than humans ever could. But there are three critical things AI cannot do reliably as per now is apply clinical judgment, interpret pair-specific rule, or understand the context. And coding relies on exactly these three skills. Now, why human coders remain essential? A medical record is not just a data; it is a story of the patient. It is a story of the patient, of a diagnosis, or of a treatment, or a medical journey. AI can read words; coders understand the meaning. AI can be fast, but coders make sure it is also correct and defensible. Especially in Abu Dhabi with strict DOH regulation, Shafafia validation, pair specific rule, accuracy is non-negotiable. Now let me share a story from hospital. Like they implemented AI assisted coding for one of the department. At first, the results look impressive. Claims processed faster, backlog reduced. Management was excited, but slowly problems appeared. Denial started to increase, not due to documentation or clinical issues, but AI was misunderstanding certain procedure, selecting incorrect or incomplete codes, ignoring pair specific nuisance. So revenue was impacted. Operational workload increased. Then coders stepped in. They did not panic. They did not fear their job. Instead, they led the solution, audited AI generated codes, retrained the AI system, aligned coding logic with Abu Dhabi pair rules. Within few months, the results were like the denial rates dropped, productivity increased, turnaround time improved dramatically, and leadership gained confidence in both AI and coders. AI did not replace coders, coders elevated AI. Coders became the auditors, the compliance guardians, the technology trainers. Their value increased and it never got decreased. AI plus coder is a stronger revenue cycle. The future is not AI versus coders. It is always plus AI and coders. It is not a competition. It is AI and coders working together. Automation handles routine repetitive coding, data extraction, pattern recognition, and basic claim validation. And coders, what they focus is on documentation integrity, denial prevention, clinical validation, and compliance review, educating physicians, and revenue protection. Technology speeds us up. Coders make sure that the system remains ethical, accurate, compliant, and safe. Now, a quick thought. Do you want to be replaced by technology or do you want to lead the technology? You have two choices. Either fear the automation or master it and become indispensable. I believe everyone is in this room belong to the second group. Master it and become indispensable. Final message I would like to give on this topic is like technology is not our enemy. Automation is not a threat. AI is not here to take our jobs. It is here to transform our roles. Instead of seeing coders as data processor or technology highlights what we truly are, we are like critical thinkers, analysts, compliance experts, revenue guardians, and key RCM leaders. So don't fear the technology, partner with it, lead it, and shape it. Because the future of RCM is not just digital, it is human intelligence, artificial intelligence working together. And in that future, coders are not replaced, coders are elevated. Now, I would like you to take some key takeaways from this technology and automation is like AI is powerful, but it cannot replace clinical judgment. Coders are the decision makers. Coders can elevate technology, and leading technology ensures coders remain indispensable and future ready. Now, let's move on to our next slide. Measuring coder impact through KPI. Now let's talk about something that truly determines how organization recognizes and rewards the value of coding. Why metrics matter? Performance metrics and KPIs. Because whether we like it or not, in healthcare leadership meeting, executives don't see effort. They don't see the hours spent coding a complex chart. They don't see the stress of denials or documentation battles. They just see numbers. They speak the language of dashboards, reports, or financial graph, performance indicator. And if we want coding to be seen as a strategic function, not just as a back office task. We must speak that language too, right? Like why KPI matter. Metrics do these three powerful things. It proves the value of coders, demonstrate financial impact, it wins the leadership attention, respect, and investment. When numbers improve, nobody can ignore the coding anymore. Now let's walk through the most important metric, which clearly demonstrate the coder contribution. The first pass claim rate, FPCR. This KPI answers how many claims get approved on the first submission without correction or resubmission. A high FPCR means coding accuracy is strong, documentation is clear, claims are compliant, fewer delays, less rework, and smoother reimbursement. Every increase in FPCR results in reduced cost of reprocessing, lower workload, improved payer relationship, and faster revenue flow. And the global benchmark FPCR above 90 to 95% is considered excellent. When FPCR improves, leadership immediately sees the impact because it appears directly in the revenue dashboards. Now, days in the accurate accounts receivable, AR days. AR days measures how long does it take to get paid after the services are delivered. When the coding is accurate, when the coding is inaccurate, the claim bounces back. Denials are increasing, resubmission causes delays, and cash flow slows. But when coding is clean and precise, AR days shrink, payments come faster, and the financial stability strengthens, operations run smoothly. And this leadership values this metric because it directly affects the cash flow, the lifeline of healthcare organization. Coders may not physically collect payments, but through accurate coding, we can make faster payment possible. Now, let's check the audit accuracy scores. Audit accuracy measures how often do coders get it right according to the internal payer or regulatory audits. High audit accuracy mean lower compliance risk, lower chance of penalties or repayment, stronger trust from payments, and protection during the DOH or insurance audits. In Abu Dhabi, highly regulated environment, this KPIs is extremely powerful. It sends a clear message. Your coders are not just fast, they are accurate, compliant, and reliable. This builds organization confidence and credibility. Now, let me share with you a real success story, like how the KPI transformed perception. Like in one of the OP facility, coders introduced a structured quality review system. Instead of just coding and moving on, they implemented internal audits. They reviewed patterns of denial. They corrected the recurring mistakes, educated physician, and strengthened the documentation alignment. What was the result? Was like the FPCR increased the rates, coding related denials dropped, and AR days reduced significantly. And then they saw the denials decreasing, payments coming faster, and the dashboard indicators turning green. Suddenly, coding was no longer seen as a cost, and coding was recognized as a revenue protector. Coders gained the respect, investment, and appreciation, all because numbers speak leadership language. Now think about your organization. Do you track FPCR? Do you monitor coding related denials separately? Do coders have visibility into performance dashboard? Do leaders see the financial value of coding or just the salary cost? If the answer is no, this is your opportunity. Now, the final message I would like to give through this slide is like coders do incredible work every day, but invisible work remains undervalued. KPIs make our impact visible, metrics translate efforts into measurable value, and numbers speak the language leadership listens to. When coding connects to KPIs, executive listen, management invest, coders gain the respect, coding becomes a strategic revenue driving function. Next time when someone asks, what difference do coders really make? You won't need to explain for long, just show them these numbers. Because numbers tell the story of how coders protect the revenue, how they strengthen the compliance or support the financial health, and also how they sustain the delivery of the quality patient care. Now, I would go on to the last topic of today is the key takeaways. As we wrap up tonight's session, I'll bring it all together. Let's take a moment to bring everything together. Like we have covered today coding, denials, documentation, technology, KPI, and real world Abu Dhabi examples. Now it's time to reflect on like what it all means for you, for your work, and for the healthcare system. Coders are strategic partners. The first and most important thing, first most important point. They are not just a back office staff. Without accurate coding, claims cannot flow, denials increase, revenue is delayed, compliance becomes risky. Your work is critical. You are not a support staff, you are the revenue defenders, compliance protectors, and essential players in the healthcare ecosystem. Take a moment and think about that. Every claim you process, every code you verify, every clarification you make, it directly impacts the financial and operational health of your hospital. Second key takeaway for today, like accurate coding reduces denial and revenue leakage. Every clean claim we submit moves money into the organization faster, avoid delays and rework, protect the hospital cash flow. Think of it like plugging holes into a financial dam. One missed code, one vague diagnosis, or incorrect modifier can let revenue slip away. By doing your job well, you keep the revenue cycle strong and ensure hospital or clinic staff financially stays healthy. Third key takeaway is documentation integrity, which is the foundation of everything. Vague notes, incomplete notes might fail the claim and denial increases. Clear and precise notes, due to this, coders can do their job accurately and compliance and revenue are protected. Every denial prevented, every accurate claim submitted begins with a well documented patient record. Remember that pediatric example which I mentioned earlier? One diagnosis led to massive denial. When the coders stepped up to guide the physician, denials dropped, FPCR improved, and revenue stabilized. Documentation is not just words on a page, it is evidence of a patient care, justification for reimbursement, a shield against audit and compliance risk. Now, the fourth key takeaway I would like to share is on technology. That technology is a tool and not a threat. AI and automation can scan record faster. It can suggest the code, flag potential error, but AI cannot interpret context, apply clinical judgment, or navigate payer-specific rules. Coders bring judgment, expertise, and compliance awareness to the process. When coders and technology work together, results are extraordinary. Denials drop, productivity increases, and revenue flow stabilizes. Also, the leadership confidence grow. Technology only it and elevates your role. It does not replace you. And the fifth key takeaway I would like to share is on the KPI. KPI, how it demonstrate on the coders' impact. Like coders must measure and demonstrate their impact through KPIs. FPCR, the first pass claim rate, denial rate, days in the AR, accounts receivable, audit accuracy. Numbers are the language of leadership. When executive sees FPCR improving, denials decreasing, AR days shortening, they no longer see coders as a cost, they see you as a revenue generating strategic functions. Metrics make your work visible, measurable, and undeniable. Now, every claim tells us a story. At the heart of it, every denial prevented means a patient care was properly recorded. Every accurate code means a physician's work was properly valued. And every successful claim means the hospital or clinic stayed financially strong. Coders here are more than just data entry staff. You are the storytellers, translating clinical care into codes that payers accept. You are the detectives, like analyzing the patterns, spotting discrepancies, and preventing errors. You are the protectors of the revenue, like keeping the organization financially healthy. So the next time when someone asks you, you don't just say, I am a coder. Say to them, I ensure healthcare organization survive and thrive. Because every claim, every code, every review you perform is critical to the survival and sustainability of healthcare. You are not invisible. You are essential, strategic, and highly impactful. Now, take a moment to reflect silently. Think of one claim this week where your work prevented a denial or recovered revenue. Imagine the ripple effect. the patient cared for, the physician supported, and the hospital financially stable. Now carry that pride and perspective forward. Okay. So, as we come to the end of today's session, I want to take a moment to thank each one of you. You have given your time, your attention, and your engagement. Remember, coding may often happen behind the scene, but your work is the frontline critical. So, thank you for your attention, your dedication, and your commitment to excellence. Keep protecting the revenue, keep collaborating with the physician, keep leveraging the technology, and above everything, keep taking pride in the vital work you do every day. Healthcare succeeds because of you. Thank you. Thank you, everyone, once again. Thank you, team.